Hi, I'm Pamela. I'm one of the nurses at the Evewell. Today I'll be showing you how to use two different medications, Luveris and Pergoveris. They have the same method of administration, and therefore I'll be showing you how to do both at the same time. Before you start preparing the medication, ensure that the expiry date is still valid, ensure that you have dry, clean hands, and that you have a flat surface and a clean one to work on. What you will need to prepare the medication is the actual box of medication, Luveris or Pergoveris 150, and you will need syringes of 2 milliliters and two different types of needles, a long needle and a short needle. These will be provided separately to the actual medication box. Ensure that you have everything you need before you start preparing the medication. What you will find inside the box is two separate vials. One vial that has the powder inside, and then one vial that has fluid inside. What I will do first is attach the long needle into the syringe, and we will use the long needle for mixing the medication. This is easy to remember because you will not want to inject with the long needle yourself. Now, once I've attached the needle into the syringe, I will be taking the caps off from the vials, and then we will be putting the long needle into the vial with fluid, and we will be drawing all the fluid into the syringe. Once you have all the fluid in the syringe, you will be taking that long needle out of the vial with fluid, and you will be putting that fluid into the vial of powder. You put the needle inside, you're going to push all the fluid inside, and then you're going to mix the medication. This might take from 10 seconds to 30 seconds. Usually it happens quite quickly, but just give it some time. You don't have to shake the vial at all. You can just calmly turn it around if you want to, or you can just let it be. There is usually some pressure inside the vial, and therefore you can keep your thumb on the syringe to make sure that the fluid doesn't come back into the syringe too quickly. Once you see that the liquid is see-through, it looks like water, that's when you know that the medication is ready to be used. Do not use the medication if the fluid is not see-through. When you release your thumb from the plunger, some of the fluid will automatically come back into the syringe, but if this does not happen, you can put the needle into the deepest corner of the vial, and then you're gonna draw up all the fluid back into the syringe. Once you've done this, you will take the long needle out of the vial, and you're going to change the needle into the short one. So we're almost ready to inject. When you take the needle out, be careful not to hurt yourself and put it directly into the sharp spin. Now, when you attach the short needle, make sure that it's firmly attached. So you push it into the syringe, and then you might have some extra air on top of the fluid. Now we can get rid of this air. It's not dangerous, but it might be a bit uncomfortable if you inject it into the skin. What you will do is you're going to push the plunger in, and once you do that, you can see how the air is going up, and you will keep pushing until you see a tiny drop of fluid on top of the needle. And now you're ready to inject. Now make sure that the injection area in the lower tummy under the belly button will be clean and dry. You can use an alcohol swab if you're sweaty, but otherwise there's no need to wipe the area. Now, once you've chosen the spot where you're going to inject, you will be taking the cap of the needle, and then you're going to inject in an angle of 90 degrees. You pin the skin between two fingers, you push the needle inside, and then you calmly push the medication in. Once the medication is in, that's when you'll count to 5 slowly. 1, 2, 3, 4, 5. Then you will release the pin on the skin, and you will take the needle out slowly. Sometimes there might come a drop of fluid or a drop of blood, but that's okay. You can just put some cotton pad on it and that will be fine. And then after that, you're done, and you will discard the syringe with the needle, and you will put them into your sharp spin.